Winchester is a city in the northern Shenandoah Valley with a population of just under 30,000 people. Since 2013, 174 individuals in our 6 localities of the northern Shenandoah Valley have died as a result of a heroin or opioid overdose. Northern Shenandoah Valley Substance Abuse Coalition is a coalition of different stakeholders in the area who have come together from all different backgrounds to really address this substance abuse issue. Data is an important part of fighting the opioid crisis because you really need to know the scope of the problem. You need to know the average age of the individual that is struggling with opioid use disorder. You need to know, have they had treatment in the past? What did that treatment look like? Have they struggled with a mental health illness? What type of mental health illness? What treatment might work for them that is evidence-based and following the American Society of Addiction Medicine criteria? So we have to track all of these things so that we can better treat our clients. The Drug Task Force is a very big partner of ours, and we collaborate with them on a regular basis.
Something that I've always stressed to our task force officers is keeping accurate data. By keeping the accurate data, I've been able to go back and look in the past 4 years and see that there's been a trend over the months that overdoses seem to increase. It's by seeing these trends that we're able to work with our partners like the Northern Shenandoah Valley Substance Abuse Coalition, the drug courts, the peer recovery specialists, and our other community organizations to try to push prevention efforts.
The Clarion framework for engaging these types of projects is to really take a step back and look at the different people that are impacted by this. So we have to look at the people on the front line in this case, the folks that are policymakers, people that are actually making broader decisions in their organizations, such as healthcare providers. And by taking all those into effect, we start to build analytics that allow them to understand their world.
This data sharing platform is allowing us to access data that prior to having this platform we were not able to access. It's giving us a more comprehensive look at exactly what the opioid crisis is having on our community. It's really allowing us to be able to take a more preventive approach to exactly how we're addressing this issue.
We had to work with the state agencies, the local agencies, private entities to be able to share their data in a secure manner that made them comfortable and also ensure that we didn't come into conflict with any policies out there that would govern the privacy of those that are impacted by this data.
We now have access to more data that we didn't necessarily have access to before. With all the participating agencies, just an example, the local police departments, the Substance Abuse Coalition and the drug courts, Virginia Department of Health, Medical Examiner's Office, and Valley Health, which is the hospital throughout our entire region.
And the hope is that eventually we will have all of Virginia on this data sharing platform. It will be really beneficial for us to be able to see if the drug trends that we are seeing are happening throughout the Commonwealth.
I think the community will benefit from this project and from this data because we as law enforcement will be able to see trends and patterns by using all of this available data, which in turn we can actually concentrate our efforts on prevention, treatment, and education. There are more data sets, data resources that we have through other organizations, locally and on the state level, that I hope will come on board after they see the success of this project so far, because I think it can only improve and get better. The more that you put in, the more you'll get back and receive.